There is a lot of confusion between stable angina and acute coronary syndrome. Stable angina has fixed atherosclerotic coronary stenosis. It means that the narrowing is fixed and the plaque or the fat that builds up in the inner wall of the artery is stable. So the blood flow passes through, but it is reduced. Stable angina is predictable and occurs with exertion. For example, physical exertion like walking uphill, climbing stairs, carrying heavy object, or cold exposure, or after a heavy meal, or sexual intercourse, or by emotional stress, anger and anxiety, sudden emotional upsetness. All of these might be triggers. It is short-lived, means typically happens between 2 to 5 minutes, maybe 10. It's relieved by rest or under the tongue nitroglycerin. It is stable over time, does not worsen suddenly. ECGs are normal, biomarkers like troponin are normal, and it's a chronic artery disease, not a clinical emergency. If the chest pain becomes prolonged, more than 10 minutes, 15 minutes, or 20 minutes, or it occurs at rest, or worsen in frequency, severity, then acute coronary syndrome must be ruled out. In stable angina, an outpatient care type of disease, usually you would put them on the treadmill test and they might have symptoms or ECG change. You might have to adjust their medical therapy to put down the frequency or stop the frequency of the chest pain. You might have to put them on coronary angiography, and they might have to have elective PCI. On the other hand, acute coronary syndrome would happen from a plaque that ruptures with thrombosis. They often happen at rest with minimal exertion. The duration of the chest pain is long, typically beyond 20 minutes. They are not relieved with rest or nitroglycerin. They might be associated with other symptoms, diaphoresis, nausea, vomiting, shortness of breath, and anxiety. There would be ECG changes like ST elevation in STEMI, ST depression or T inversion in unstable angina or non-STEMI, and the biomarkers would be elevated in STEMI and non-STEMI and would be normal in unstable angina. Acute coronary syndrome is a medical emergency and require urgent evaluation and treatment. In acute coronary syndrome, patient would be placed on medical therapy and reperfusion therapy. Reperfusion therapy depending on what type of acute coronary syndrome are we dealing with. In STEMI, it will be medical therapy plus urgent revascularization with PCI or thrombolytic therapy. And in unstable angina or non-STEMI, it would be medical therapy plus or minus coronary angiography depending on clinical risk assessment and complication. And just to go deeper into acute coronary syndrome, the difference between unstable angina, non-STEMI and STEMI, that in unstable angina there is incomplete obstruction without cardiac damage. In non-STEMI there is incomplete obstruction with cardiac damage. And in STEMI it's complete obstruction with severe cardiac damage. So the narrowing itself in unstable angina is minimal or narrow enough to cause persistent chest pain, but not narrow enough to cause cardiac damage. And in non-STEMI, there is reduced blood flow that is enough to cause cardiac damage. And in STEMI, it's completely obstructed, therefore there is severe cardiac damage. So I hope that clarifies the difference between stable angina and acute coronary syndrome.